mean, it was just this litany, a pretty significant discussion today in terms of where we are and where we need to go. So with that, I have called the meeting to order. We do have quorum. And next item on the agenda is the minutes of the previous meeting, which was June 4th. I'd like to have a motion for approval or modifications to them.
I move to approve the meeting.
Thank you, Jeannie. Do I have a second? Thank you, Tori. All in support, just raise your right hand. Okay, good. Okay, moving on. Karen and I worked on the agenda. There have been some modifications, as you probably all know, that came through pretty late that modified the agenda again. And we're going to be adding a conversation towards the end about having a board meeting next week as a result of POLIS's new orders that just came out. So we're working through all of those, and Karen with her staff are working through those. But I'll stop there and turn it over to you, Karen.
Sure, yeah, thank you, Marky. So I wanted to request that we add just a broad overview of the Protect Our Neighbor phase that Governor Polis put out some kind of preliminary frameworks around. I think that this is a real big paradigm shift in how communities will be working toward their own kind of roadmaps to reopening, as well as data indicators that will kind of allow forward or not through that next Protect Our Neighbors phase. And so because there's still a lot of information coming out on it, felt that it would be more important to just bring it forth today. And if you haven't had a chance to look at that framework or the accompanying PowerPoints with it, I shared that, I think I shared when Governor Polis was doing the presentation on it with all of you, but you may not have been able to see it. And I know it's been going around, but I'll send that out for all of you to review. And then I think it is important for us to touch base on this next week, because it would really be a conversation of, do we want to stay in our current roadmap to reopening that we developed and going into our third phase, which is what phase we were projecting to go to in July. Do we want to consider the Protect Our Neighbor phase? So there's sort of that conversation. And then what are the data points that really allow us to move forward in that Protect Our Neighbor phase? And that's the data that we've been collecting for a while. So it's not that different probably than what will be revealed or asked of us to do. But because it's a real different way of going about this work, I wanted to request that we did have a board meeting next week to talk about it further when we have more information.
Okay, is Charlie, you ready? Is that where we are, Karen? Do you have any other comments? Okay. Hello, Charlie, how are you?
Okay.
Yeah.
Sure. All right, well, Dr. Levin and I are going to review the data that we have on where we stand on everything at this point. So as usual, I like to start with a little history and see if this sounds familiar. An outbreak occurs in the US of flu-like symptoms, sore throat, fever, tiredness, headache, and stomach ache. There are 27,000 cases in the US and 6,000 deaths, and over a third are in New York City. Some hospitalized patients need to be put on ventilators. And I'm not describing New York City in 2020. This was 1916, and the disease was polio. So you can see in the picture on the screen, ventilators have come a long way since then. These were the old iron lungs that kids were having to be put into to assist with their breathing. peak numbers of cases, paralysis, and deaths occurred in the 1940s and 50s, with over 52,000 cases in 1952. And we lived with this virus. The reason I bring it up is we lived with this virus for over 60 years before a vaccine virtually eliminated the disease in the United States. And I remember as a kid being lucky enough to receive the Sabin oral sugar cube vaccine rather than the Salk 23 gauge needle vaccine shot, which was no fun at all. The last known case of endemic transmission of polio in the US was in 1979. So we live in a society today that's trained for immediate gratification. Here we are really anxious about putting COVID behind us 6 months after it emerged in Wuhan, China, where the polio we lived with for 60 years. So as our data will show, and as we're seeing in the news every night, the reopening of restaurants, gathering places, and increased mobility in general have resulted in increased numbers of cases. So the question is, are we in a second wave? And most experts, and I agree with them, say no. What we're seeing are imported cases, spikes, and clusters related to the first wave. We did a tremendous job of flattening the curve and decreasing our effective reproduction number to less than 1. But now, as we reduce suppression strategies, any number of increased positive PCR tests or contained clusters of cases are very visible. But what this comes down to now is personal responsibility for your actions and interactions. The increased numbers are reminders that we're still in a pandemic, and we have to continue to adhere to the 5 commitments: socially distance, wash your hands, wear a mask, stay at home when sick, and seek testing and self-report if sick. So have those restrictions been effective? The answer is absolutely yes. And has there been a big economic cost? Also, absolutely yes. And I just wanted to share one data point from history from the 1918-1919 influenza pandemic, that cities that implemented stricter suppression strategies, like we've done here in Pickens County, actually recovered to a higher level of economic success. So that's kind of encouraging. We do see how different states, counties, and towns are approaching this pandemic. And I believe we're on the right track from a medical and public health perspective, and equally now concentrating on balancing with our economic recovery. The studies that we're seeing now continuing to emerge show that the most significant variable in determining whether an outbreak is controllable is the delay between symptom onset and isolation. So you can see in this graphic, the people in that inner circle that have had exposure for greater than 15 minutes are the ones that we need to contact and isolate very quickly. If 80% of contacts are traced, the probability of achieving control is 89%, but it drops to 30% or less the longer those delays are between identifying people and isolating them. So our primary strategy now for control and interruption of the transmission of virus is to make testing widely available and use robust case investigation and contact tracing. Our focus here is identifying every individual we can that's PCR positive and look at specific businesses and specific sectors to eliminate community spread. But we do need to also couple that with a significant focus on protecting individuals whose age and/or physician determines they have underlying conditions. Those are the individuals who represent the highest risk of hospitalization. And we also need to keep our eyes on what's happening in other areas. We have a bit of insider information from a new addition to our public health team. Joshua Vance, who you'll be hearing from more in the future, is a new full-time epidemiologist that's joined our team. Josh came to us from Texas, a state which opened up quickly and broadly. And now they're experiencing what we hope to avoid, hospitals nearing capacity with COVID-19 patients. This chart shows that Texas has less than 25% of hospital beds available now. They're up to 75 and 80% levels. Colorado, by comparison, has a total of 164 patients currently hospitalized for COVID-19 and only one here in Pitkin County. So we're doing, I think, the right thing by moving slowly. So I wanted to dive a bit deeper into our data and show you, which we are sharing on the dashboard, which you can always find at Pitkin County COVID Stats website, and click on that to get this graph. We've added a new chart that shows positive and negative test results and positivity trends. So here's where we are today. 2 weeks ago, we were at 452 people tested and 23 positive. Today, we're 678 with 38 positives. Our positivity rate has crept up to 6% overall from 5%. And if we just look at the 226 tests that performed in the last 14 days, the positivity rate is 7%. So it's creeping up a little bit. And you might recall that WHO and CDPHE have set a threshold of 10% for positivity as a measure of whether we're doing enough testing, given that the overall prevalence of COVID-19 is closer to 3 to 5%, right? We'd like to see our positivity rate stay below 5%. So that's something that we'll be watching, and I think that will be part of the data that CDPHE will be asking us to continue to present to them. Here's the chart that shows by week our overall positivity rate and you can see how it declined when at the beginning of this outbreak, we were just testing people who were hospitalized or had significant symptoms. Now we've added a lot more testing, and so our positivity rate has come down to about 5%. If we break up the data a little bit, asymptomatic pre-op and OB patient positivity rate is 2%. Those are the people coming to ABH for an outpatient procedure or an inpatient procedure. But if we exclude those and only look at medical and community testing, our positivity rate is up to about 8%, which is an uptick from 7% 2 weeks ago. And increasing positivity is an indicator that we need to do more testing to catch both asymptomatic and symptomatic individuals, as well as those that don't have any disease. When we look at cases, we had 15 new cases in our database over the last 2 weeks. 3 we can identify as being imported or coming from non-adjacent counties, Colorado counties. 1 came from another state. 2 were known outbreaks in an adjacent county, so we could link those cases. 1 had an illness that maybe dated back to March, but for a variety of reasons is still testing positive. We're not sure that it's a new active infection. 1 was linked to a resident that was exposed out of state and came here, who is now back in Pitkin County. So we can kind of track where that infection came from. 3 were linked to a Pitkin County workplace, and 4 may be unlinked community transmission. We're not sure. It's interesting as you go through the case investigation and contact tracing on these, that you eventually find where those links come from. But 4 right now are unknown, and 1 is still under investigation. So it's been a busy 2 weeks from a case point of view. I've showed you this graph before. It's to show how travel is coming in from other counties and how it compares to travel within our county. We're basically back up to about 84% of pre-COVID levels in terms of people coming into the county. And so now we look at how what's happening in our adjacent counties. Our new cases here in Pitkin County, as compared to our 7-day moving average, is increasing. We had 15 in the last 2 weeks. Eagle County's case trend is increasing as well, but they have a relatively low number of cases compared to their population. They have about 33 new cases, but they have more than twice our population. Garfield County is increasing as well, with about 49 new cases and 3 admissions to Valley View Hospital. So 2 weeks ago, they were at 150. Now they're at 199. And cases in Colorado are also increasing. We're not sure. We've certainly seen the effects of Memorial Day weekend, but we probably still a little bit too early to see the increases from the mass demonstrations. We should see that over the next week or so. So where does this all mean? Is the sky falling? Are we approaching a threshold on our indicators? Or is it just our new venture out instead of stay at home normal? The data suggests kind of the latter. That bears watching for continued signs of community transmission and stepping up our capacity for case investigation and contact tracing. If you look at this chart, you'll see that there are a couple things that stand out that we're concerned about. One of them is those unlinked chains of transmission. If we can link those up and find where they're coming from, that will give us more assurance that we can box it in and keep our arms around them. The other thing we're watching carefully is what's happening in Garfield and Eagle counties, because a lot of people are coming to work here in Pitkin County and bringing with them the potential for more transmission. It's kind of, I think if I had to use an analogy of where we are right now, if you've ever played the arcade game Whack-A-Mole, you take a little guy pops up and you hit it with a little mallet and it drops down, and it starts off the game very slowly. One pops up over here, easy to hit it. Other one pops up over here, easy to get it. But as the game goes on, they start popping up faster and more than one at a time. And that's kind of where, I feel like we're still in the slow mode right now. We are able to keep up with the demand for case investigation and contact tracing, but we need to keep building out that team to be ready as the game increases in speed. And I think that's where I'm going to end it for now. We'll have time for questions afterward after Dr. Levin presents, and I will turn it over to her now.
Thank you, Charlie. Let me just share my screen here. Whoops. Okay, can you hear me okay? Okay, great. Okay, thank you. So I'm going to present the hospital data, and this will be fairly brief, but this is the AVH capacity matrix, which was embedded in Charlie's epidemiology matrix, and looking at the 3 variables. So the hospital isn't comfortable at all 3 levels right now. The inpatient hospitalization has greater than 50% capacity in the comfortable range. Just want to make a note following from what Charlie noted in Texas and Dallas, that their capacity rate, which happened from this, we got the information from the insider scoop here, they were in this concerning phase, and that happened very quickly for them. We are here, comfortable in terms of the average daily visits in the ED. There's less than 6 a day. The respiratory tent has less than 10 a day, and community testing is less than 16. I will note, and I'll show you a graph in a minute, the respiratory tent is booked up to 8 a day for today and tomorrow. So these numbers are rising in terms of, again, the respiratory tent is for patients who are symptomatic. and are being seen in the respiratory tent. And then comfortable as well in essential health care workers. There's only 2 out right now, which is an increase from 0 last time, that have COVID-like symptoms. And we're in the comfortable. So this is the weekly respiratory clinic patient visit volumes. And you can see that since the middle of May, we are on this increasing upward slope. And this very last bit actually is up. This is not, they haven't been entered yet, but these will be continuing to rise with the 8 today and the 8 tomorrow. So we are increasing number of visits in the respiratory tent. And the curve has gone up since the beginning of June. And then again, these are kind of, they look very simple graphs because they're weekly averages. So the community testing volume has increased substantially since the end of May, May 27th, since things have opened up. We've had an upward slope in the community testing volume. And this is similar to Charlie's graph. It's a run graph in terms of these are COVID positive PCR active disease tests done at AVH by day. And this starts in the middle of March and runs all the way to the present. So as you can see, we enjoyed this area in between really in May, May 24th, the end of May, May 24th up to June 3rd, where we had no COVID positive patients. And then there was a couple, and now you're seeing there are clusters. And in the past week, as Charlie had mentioned, there's 15 new in the past 2 weeks and 7 new in the past week. So this is a concerning positive number, and we've seen these in the papers. The timing, if you look at this, at the end of our opening on May 28th, we have a over 3 week timing, which is about right in terms of opening Memorial Day weekend and opening restaurants and lodging, that we had expected to have an increase, and we are seeing it in the data. In terms of inpatient only, so these are people admitted to the hospital, admitted to the hospital. Currently, the hospital has 1 COVID positive patient, and that's on the PCU and the patient care unit, not the ICU. These, if you look at the numbers, again, very low, and that positive patient is the first one in the past 3 weeks. Okay, so the hospital capacity is comfortable, and there's only 1. These are little spikes because they were PUIs, persons under investigation. So they had COVID-like symptoms, but in the past 3 weeks, there's only 1 positive. What I do want to mention, which I think is very important in looking at this graph versus the one we just showed, where there is an increased number over the past 2 weeks. There's been 15 new cases. There is at least a 10-day lag with hospitalizations and new cases reported. So from the time that people get diagnosed to when they may need hospital care, there's at least a 7 to 10 day lag. So we may not be seeing this yet. This is our healthcare worker. There's only 2 out right now. Again, we're low. There was a spike, and I've showed this one before, a spike in the end of March, mid-March. And this just shows positive and negative COVID-19 PCR tests by week, that we have an increased number, a vastly increased number of testing that we're doing. And now we're on an upward swing of the positive tests, which is in the blue down below. And these are cumulative. So we're up to 27 positives, 366. These numbers are a little off from Charlie's, but these are through June 13th. And so we're having cumulative increase in positive and a large increase in testing as well. And so it's really the positivity rate that you want to look at. And what I think is important, I'll echo what Charlie said, that there's different positivity rates. There's one for all the tests, which include asymptomatic patients. And in the pre-op and C-section pre-induction testing that we're doing on asymptomatic patients at AVH, there have been 2 extra positives in the past week. So there's been a total of 5 with a positivity rate of only 2%. But if you look at the medical testing, the people who have symptoms and come in for testing, their positivity rate, as Charlie has explained, has gone up. So it's gone up from 5 to about 8. There is some data that it's gone up even a little bit further than that. And I think that's actually really important to look at the people, there's more symptoms and there's more, on average, the percentage of those people presenting with symptoms have COVID-19. Those are old. Again, the essential part of this is that you get tested if you have symptoms, and we're urging everybody to get tested. As we move through this, and the process now is to identify new cases, and within the fastest period that we can, to contact trace, investigation, and box it in. That is the only strategy moving forward to be able to keep the economy open and move through this safely. So the way to enter this system is to get tested if you have symptoms. It is critical. Again, the 5 commitments of containment, and I know they sound so simple, but these are the basis of how we are going to make this work moving through. If everybody commits to these, we can all do this together. And if we start not using these, we're going to find an increase. Let me stop this share for a second. I just want to share one more thing, if it's okay. This is just in coordination with what Charlie was showing in Texas. This is from the New York Times, and I just wanted to spin through this quickly to show you what's going on in the US and the increase in cases across the US. So these are the hot spots in the United States, a lot in the South, Southeast. And I thought this was very interesting. These are where new cases are increasing. So there are 20 states where there's new cases increasing, and this is highly concerning. And I think this is a lesson to us, again, that the commitments, the 5 commitments, are going to keep our levels flat or decreasing. And in places that are opening too early, this is going to happen. And we know it's going to happen here. And I think we've already seen some of the effects of it with the recent cases over the past week and 2 weeks from our opening at the end of May and Memorial Day weekend. And I think that's it. I just wanted to mention also the 55, the commitment of social distancing at 55 to 65%. If we all do that, we're protecting the vulnerable population, we're protecting ourselves in terms of being able to move forward with the economy. So thank you. If there's any questions.
Okay, we'll look to see if we've got any questions. Charlie and Kim, thank you for those excellent presentations. Any questions for either Charlie or Kim? I don't see any hands going up. I guess the data is the data. A little concerning, quite frankly. You know, constantly is reminding people what we need to do, what our commitments are. Karen, any final takeaways from the information as we get ready for the next part of the agenda?
Yeah, I think just to echo what Charlie and Kim said, that we're actively monitoring, obviously, the data, and knowing that this isn't unexpected, right? Especially when we think about how this, as Kim said, sort of ties back to Memorial Day weekend, some of the openings that were happening here as well as throughout the state. And so it's, we know that when you start to lift suppression strategies, you're going to have greater transmission through the community. So it's not necessarily, this outcome isn't necessarily a surprising outcome, but it's something that we want to be on top of and paying close attention to. And as you can see, the team is definitely on top of that. When Kim was mentioning the social distancing, this is an indicator that the state is using as a way to determine movement into next steps as well. And it feels like really odd to me to say, like, what does 65% social distancing mean for me personally, or 55%? And really what it means for me is that if I'm looking at like 50% social distancing, I would be cutting my activities in half. So if I normally went to the grocery store every week, maybe I don't do that every week. If I normally interact with groups of 10 people, maybe I only interact with groups of 5 people. If I normally go socially out to go to a friend's house 5 times a week, then I do that half the amount of time. So just thinking about it in context of how do you like make that real for yourself. And so 65% of your activity is reduced. And so we can all take that personal responsibility to really reduce our interactions, our social interactions, and to continue with the 5 commitments of containment, which is really our personal responsibility. And if we do that, and if I think we can be successful, but it really takes the whole community to be committed to that.
Brent?
Hey, stop. Sorry.
Brent, you're on mute.
Yeah. Is that better?
Yep. Now we
So
can hear
sorry
you.
about that. Thought I did that. You know, something that I've seen, I'd be curious if others have seen this. And of course, I live in Aspen and I live downtown, and I have seen a number of occasions where people in excess of 15, in one case probably 25, together without masks, of a not young people, post 50, post 60, and there's a bit of an attitude, and the attitude is, you know what, we're just tired. Let's take a chance. We don't care. And I've seen it, as I say, a handful of times, maybe a little less than 6 for sure, maybe 4. But it's concerning in that that's an attitude that I hear and see. And I don't think, maybe I'm wrong here, but other cultures have a different connection to social reinforcement and to protecting each other. There's a higher duty there. And I think we're seeing, at least in my view, what I'm seeing is a lack of that. And I don't know how to counter it other than somehow convincing people how serious this is. And if this thing breaks down, and I'm not a mathematician or statistician or anything else, but when this kind of thing breaks down, it breaks down at the margins. Everything is easy in the beginning. You're scared, whatever. But it's when it gets tough, that's when we need to do it even more so. And especially now that we're seeing evidence of this thing increasing all over the United States. So we need to be tougher now, even perhaps than we were, in my view. And that's really difficult. And we've got to figure out some way, if we can, to counter that psychological mindset of fatigue, and that it's not really as important or as bad as it's being portrayed and so forth. And I'm very concerned about, and especially about our valley. Thanks.
Thank you very much. Patty, I know you had your hand up as well.
I didn't know if you wanted me to add this as part of the round robin, but since Brett, I'm kind of on that same track because I too live downtown, and I'm seeing the same thing in all generations across the board, in just walking through town or on the local trails and through neighborhoods locally. And I don't know what the answer is on how to remind people that we need to be cautious and we need to take these steps. But Karen's point about this, which was very good, 50% of my own activities, how do we get that message out to people? It's good for you and me, Marky, to say, I'm gonna cut down my interactions by 50 or 65%. How do we get that out to people? You can still visit your friends, just not as often. And just cut down those opportunities for infection or passing of infection. That's another message we need to get out. That in turn brings me back to a bigger concept. Something we need to talk about at some point during this meeting is communication. We are still having issues with communication internally and externally, and that's something we need to address hopefully at some point during today's meeting.
Okay, thank you. You know what, just listening to you, Patty, I think we're going to have to really rely on multiple media strategies just in terms of communication. And I know we have reporters on our video today, and I would ask that we charge them to help us get the word out immediately of what's going on in the observations shared by you, Patty, and Brent. And later in the meeting, we will get a communication, but just to, go ahead, Patty.
Speaking with the press, which I do quite frequently, the press is having trouble getting people to return the press's phone calls from our Department of Public Health. and they kind of are feeling like they're getting the runaround. They would like to assist us in getting these messages out, and they just want to make sure they have accurate information. So rather than report inaccurate information, they may not be reporting as much as we would like them to, or we could take advantage of them reporting. So we need to increase our communication to the press so the press can then in turn communicate with the rest of the public. So that's something I think we need to try and figure out how to address. Thank you, Marky, again.
Yeah. Greg, did I see your hand up or no?
Yeah, I did the electronic hand raising on the chat, but I don't know if anyone can see that. So I'd certainly back up what Patty and what Brent were saying. I was on the call with the state health director this morning, and I could get a sense from all the commissioners on the call statewide, including some of our own, that there's a sense of frustration that communication still is pretty tough. So this is a statewide issue. And I do know that Karen and her staff have made pretty big efforts to increase the quantity and quality of the communication. I think Tracy has been brought on for that reason. So I think we are making progress there. The thing that I wanted to ask about was last week, I think Charlie and Karen brought it up. We've got the 65% social distancing for normal, healthy folks. But for older and health impaired people, I think they're recommending, is it 80% social distancing? So that would mean cut your activities, your social activities down to 20% of normal, do it a fifth as often. And the state call I was on today had a series of charts, which I've sent to several of you, which maybe you can decide if you want to share or not, but it shows where we're going with this according to their projections, whether we social distance at 65%, or if the older population goes to 80, or or we kind of somewhere in the middle. It's really sobering, and it's revealing about what people are anticipating. So I have to underscore that I'm not sure we're taking this as seriously as we should. There's been this great sense of relief lately that we're reducing cases, but this may not continue, and it could get worse. So I'm all in with the communications and our efforts to reach out and share with the public what we're seeing. And I think we're seeing this statewide regarding this need to increase our communications and get everyone on message. Thanks.
Thank you. Kim?
Thanks for saying that, Greg. I just wanted to comment that the 65%, my understanding is that if we all do 65% as a collective community, we are protecting the vulnerable population who are going to have morbidity and mortality from this disease. If we go lower than 55, 65% down to 45, then the older population is going to have to increase over 80% to be able to protect themselves in the same manner. So as a community, we can all come together and say, hey, we're going to protect each other and have a little higher rate than having to kind of stigmatize an older group and say, hey, you just can't leave your house. Because 100% is complete isolation. And yes, if that group did complete isolation through this entire process, then we would do a lot better. I mean, in terms of numbers, but it's not fair to that group to say, hey, we can go down to 45, but you have to stay above 80. So let's all meet in the middle at 65, which is still a lot. But I think that's my understanding of those numbers. Karen, correct me if I'm wrong.
Thanks.
So you got it exactly. Yeah, thanks. And I think that's a really key point. Yeah.
Okay, let's move on to, if there's any other comments, we'll take them, but I'm looking at our time, so I'm going to move on to Jordana and Jeanette and John Ely, and this is all about the Consumer Protection Program, the Employee Protection Program, our structure, our education, compliance, and enforcement process. And really, we need to applaud the people who work so hard on really getting this aspect up and running and ready to go. And with that, I'll turn it over to Jeanette or to Jordana.
Yeah, this is Jeanette. Can everyone see my presentation?
Yep.
Okay, great. This is my first time presenting to the Board of Health. So I am the Senior Environmental Health Specialist for the City of Aspen. And since Pickens County's public health COVID-19 response began, the city has offered my time to aid in this effort. My recent work has been with the development and support of the county's COVID-19 Consumer Protection Program. This presentation will provide the Board of Health with an overview of what this program is doing now and what it will look like when we're fully staffed in July. The foundation of the Consumer Protection Program is to support our businesses to safely reopen and stay open during this pandemic. Communication, education, and collaboration are key. So where are we today with these principles or these factors of the program? For education, the business liaison team has been providing support to the business community on the sector guidance developed for sectors that are currently open in the safer at home phase. There are several different industry groups, lodging, restaurant, outfitters, and guides, and more, who have been participating in the development of the guidance and continue to provide feedback on additional guidance that is needed, like what to do when an employee is positive for COVID-19. Aspen's downtown service manager has also, Mitch Osier, has also been providing local support to the downtown businesses in Aspen. Outreach and monitoring. Law enforcement in each jurisdiction conduct a level of monitoring as part of their shift. County and city rangers have been providing community presence and education in the field. Construction sites have had increased oversight by local staff of building, engineering, and police. And our community provides a level of education and monitoring when they speak of and model the 5 commitments of containment. For the compliance as of today, law enforcement have been the backbone for compliance in our community since the beginning of this pandemic. The non-emergency number for dispatch has been the complaint line for COVID, which then routes the complaints to local law enforcement. Law enforcement then responds accordingly based on the severity of the issue as well as the resources available. Public safety is their #1 priority. Aspen has additional staff that assist with compliance in the construction, business, and community sectors. In enforcement, when voluntary compliance cannot be achieved, the complaint is given to the county attorney. And I'll let John speak to the COVID enforcement process.
Good afternoon. Take a minute and digest the chart that Jordana and Jeanette worked on. It's perfectly accurate and reflects not only the community approach to law enforcement generally, but what is thought to be the best approach to enforcement of public health orders and any other rules, regulations, or statutes concerning public health. I think that the first thing I would make a comment to on the chart is that it tries to isolate different steps and to show a direct line from, if you're here, you move to here. If you're right, you move down to the next preceding square. The actual business of enforcing, say, a public health order in the situation we're in now is not necessarily that rigid. We can certainly skip ahead a couple of steps or all the way to the end for that matter, or we can expand it if we continue to get progress but not complete progress with somebody who is having problems, let's say, with adhering to the strict terms of a public health order. So when a complaint comes to my office, it's already been dealt with a couple of times by somebody else already, whether it's a law enforcement officer at one of the agencies locally, or whether it's the public health department, or whether it's a participant in an individual business model, say a contractor in the business model for operations of running construction projects and complying with health orders in that regard. So hopefully there's been an opportunity to extend the sort of education and communication to the individual or group that's not. Can you guys hear me all right? Okay. So there's already been an opportunity to to reach out, express some degree of understanding to that individual or business, explain what the health order means, explain where they're falling short, and tell them pretty much particularly what they need to do in order to bring themselves into compliance. So we're dealing now with a party that has not been either cooperating or just hasn't been able to get there. And in order to focus attention, the complaint moves to my office. And that frees up time for all these other individuals, law enforcement officers, public health department employees and staff, etc. So when I get it, I basically repeat the same effort. There's an effort to communicate, to explain, and to describe particularly what is required pursuant to a public health order. Depending on how the conversation goes with my office and what we've been informed of through all the other people who have made the same attempt, we'll either continue trying to communicate and to elicit compliance, or we'll start skipping ahead in the procedures for enforcement. Now, generally speaking, you can divide, in this chart, the activity for enforcement has been roughly divided between business activity or individual activity. Individual activity, chances are, has already been dealt with before the case or the issue reaches my office, simply because if it's an individual who is not complying with a public health order, they've probably been met with a law enforcement officer. The law enforcement officer, chances are, is dealing with somebody in the realm of not wearing a facial protection or a face covering, or is or engaging in conduct that is violative of personal space. In other words, encroaching on the 6-foot limitation for interaction, something like that. The law enforcement officer, exercising the same discretion they have in any other type of law enforcement scenario, whether it's a speeding case or a tussle, in an alley somewhere or whatever that is going to make a judgment in the field right there as to whether or not they feel that this is something that's serious and needs more than a communication, more than trying to settle a situation and obtain compliance. The law enforcement officer is free to write a summons and complaint and serve that person into court. The law enforcement officer is also free to make an arrest. Of course, when you're dealing with public health orders, the idea of making an arrest precipitates all other kinds of concerns, particularly about what do you do with the individual once you've arrested them. But the idea is that the law enforcement officer can take immediate action to deal with a situation that is potentially threatening to other individuals by one individual. It can be any number of things, and we've had a few examples of that in the community. I don't want to go into specific examples, but I'm sure everybody's aware of reports in the paper that have covered those types of situations. If the complaint involves business activity, in other words, something that is not personal from one individual to another individual, the conduct of business in relation to a public health order, for example, the same efforts are made to communicate, to educate, and to describe what compliance is. The simple case scenario might be a restaurant that has not provided sufficient space between a seating arrangement or something like that. There are many other examples that could fit into that category. However, if there is resistance to compliance, or there just is not a productive compliance, even if the person is attempting and just is not able to succeed, then we can take it up a notch, so to speak. And the response can be tailored based upon the circumstances. So we don't necessarily have to follow to the straight line of the diagram, but it's there as a guide. So the next step up can be one of two things. Either we write a complaint and bring the individual or the corporation, LLC, or what have you, into court and refer the matter to a district court judge. The district court judge can respond by simply layering another court order on top of a public health order to reemphasize what type of conduct is necessary. Or the court might appreciate the circumstances differently and decide to effect a different order, for example, closing the business, or well, it could even lead to confinement by the individuals who are violating the order if something is that egregious, although that is certainly a situation of ultimate last resort. The other proceedings that are available to us are simply to direct the conduct specifically in a newly issued order. The public health director has the ability to leapfrog over a judicial process and to close down a business, for example, or to restrict that business or other similar businesses in a way that more completely addresses a problem or more adequately ensures against increased risk of transmission, say of a disease or virus like the case we're in now. Based on those types of actions, the situation can get even worse for a business in the realm of public accommodations that are serving or that depend on serving alcohol for an element of their business. Revocation of an alcohol license or a liquor license of any kind is quite a blow to that business, and not only immediately, but potentially in the future when the business tries to reestablish and reopen. It's sort of the, I guess, the nuclear option, if you will, in the situation of someone who has a retail liquor license or a tavern license or any other type of retail liquor license. So the idea is to adopt a traditional Aspen, Snowmass, Pitkin County approach to law enforcement, to meet an offense with communication, with education, with an explanation as to what has to be done, and to try that a couple of times until it's really obvious that you're not going to obtain compliance, and then to ratchet up the steps all the way until you get eventual compliance. Now, in the realm of a public health order, for example, the situation can be compressed, and the reason it can be compressed dramatically is because of the great concern for the protection of public health, particularly if you're dealing with a situation involving, say, increased risk of transmission of a disease or a virus type vector. And so if there is a situation of immediate harm, we can simply jump right to the end of the game to stop any type of activity by the individual or the business, and in so doing, obtain immediate compliance with the public health order. If the situation is such that it presents such a concern or such a complication or such a potentially dangerous consequence, if we let something continue or continue too long or continue in a sort of halfway measures with compliance and not jump in and do something more drastic. So in the realm of dealing with public health, we have to be, I think, considered in what we're dealing with and who we're dealing with, and judge the response to the degree of severity that that particular activity or failure of compliance, what that means to public health in general, transmission of disease or viruses particularly, and the risk to the public at large if something is allowed to continue. So with that, are there any questions at this point?
John, I have a question for you. It's Marky. When you're talking about all those beautiful boxes, and this is an excellent, excellent diagram, When would a restraining order be issued, and what does that really mean?
A restraining order is a particular type of court order. Typically in this scenario, what you'd be dealing with is a temporary restraining order, or a TRO. A temporary restraining order is something that you can receive immediately from the court. It is designed to maintain the status quo or immediate compliance with a judicial order, in this case, a public health order, or any other aspect of the law. It is temporary because it is designed and established in Colorado law only to survive for 10 days. So within the 10-day period that a temporary restraining order is viable, you then have to proceed and prepare for the next step in court to obtain either a preliminary injunction or something else. In this type of a scenario dealing with public health issues, I would say that the times that we would go in with and seek a temporary restraining order and then follow that up with a preliminary injunction would be rare, simply because it is time consuming. Now, I mean, you have to go to court several times, and to do that, you have to prepare staff to be witnesses. So that takes away from other aspects of their job that they're doing. And the problem can be met after a TRO is obtained by different means, rather than following it up with a request to the court for a permanent injunction or permanent relief. Otherwise, with a judicial order, we can establish what we want with a revised or specific health directive from the Board of Health or the Public Health Director.
A follow-up to that. So if we have a business where there's been a lot of education and we still don't see compliance versus doing a TRO, can you jump all the way from revocation of the liquor license or food license?
Yes, the answer to that is absolutely yes. And we have been in communication with the state liquor board. The local liquor licensing agencies, of course, are the individual municipalities in the county, depending on where the business is located. And the state has exhibited and told us directly that they are ready, willing, and able to participate and to assist in any situations where it is the opinion of the local liquor licensing authority or the Board of Health or the health director that their participation is needed, warranted, and requested.
Thank you. Are there other questions?
Yes, I have one.
Hey, Brent, go ahead.
Yeah, basically, and again, with all due respect, but for me, when we have to seek legal recourse, we've failed. To me, this has to be, I was going to say local, but it should be immediate. And a good example would be, and I just was in a restaurant where some people came in without masks, and I even said to the fellow, I said, does that happen very often? And he said, well, yeah. I said, why don't you ask them to put a mask on? And he didn't want to do it because he doesn't have the social enforcement or reinforcement, apparently. And I have had, and I'm going to go on with this, but I've spent a lot of time in Europe, and I have had one case, I had a foot on a seat in the train, and an older gentleman, probably even older than I am, came over to me and said, move your foot. And I was embarrassed. And I said, what do you mean? He said, you don't put your foot on another seat like that. And I thought, how wonderful that those people care enough about their public, facilities to make sure that they're kept up. And I say that, to me, that's what a little bit of that is what we need. And how we get to that, on the individual level, most of these groups that come and go are going to be like the locusts. I mean, there's no group in 5 days. So for me, we need that legal reinforcement, and to the extent that we do need it at the extremes, I believe it should be pretty immediate. It shouldn't be an escalation. It should be bam, you just lost your liquor license for 5 days or something. And if they knew that ahead of time, those offenders might change. But I think more importantly is getting the individual restaurant and the individual offender that we care about this. Tell people to turn around and go get a mask or have masks available. But for sure, try to enforce it, at that initial entry point. Anyway, that's it.
Marky?
Yes, is that Ann?
Yeah,
Go.
yeah. I didn't know if you're doing the raised hands or the.
Well, I don't see everybody. I just see slides, so.
Oh, that's right. That's right. Sorry about that.
Yeah.
So two things. First, Brent, I mean, that's why the city of Aspen has passed and extended the mask face covering requirement ordinance so that it does enable, it still doesn't mean people will bring that up, but it does enable business owners to say, this is the city law. And it's not just peer pressure to wear your mask. Secondly, we've all been aware of places non-compliance and repeated non-compliance in some places. So this is to John Ely. Have we gone through the effort to bring people into compliance and we're past that? Is any action being taken towards any of these places that continually are out of compliance and have been for weeks? Are we at that point yet?
And I would answer that in the affirmative, that there has been continual action on all complaints that have come up in the chain, so to speak, with situations that did not involve immediate compliance. But in response to Brent's statement, I mean, yesterday I was in a Starbucks in Summit County, and the guy who came in behind me didn't have a mask, and he was turned around on his heels and sent out by a very
Good.
diminutive looking sales clerk. But the thing of it is, whether you're dealing with what appears to be a recalcitrant type of a repeat situation that Ann is concerned with, or the first time where you want to slam them, the thing of it is that you can't rely upon or pass it off onto the business owner. I mean, you know, you would expect that in maybe most of the time people would respond and say, please put on the mask, or nope, I can't serve you unless you have the mask, something like that.
Yep.
But that type of a response to a non-compliant situation to a health order is always going to be, erratic. It won't be uniform, it won't be consistent, and it won't necessarily be what you want. You don't need to have, a real push and shove develop over somebody
That's true too.
who wants to have everybody following the health order and somebody who wants to, I don't know what, assert their individual choice or something silly.
Yeah.
So in the handicap that that our program has suffered is that we don't have a dedicated person to respond to complaints. So they come in and even relying on law enforcement, that's a difficult chore because law enforcement is doing a heck of a lot of other things. So to fold that in to a law enforcement message is difficult. And although my observations of all the local law enforcement agencies that they've been on top of it and they've been attempting to do that. But again, it's a difficult lift. And without some individual who's dedicated for enforcement, much in the same way all of our local land use regulations are enforced in the county and in the municipalities, to have an individual who goes out, periodically does walkthroughs, periodically shows their face, engages in some sort of a communication effort, educational effort, a follow-up for the problem, situations. It's difficult to have to execute on this mission of communication, education and compliance, and to jump right into let's go for it and put them into jail type of a mode. I don't know if that in the long run is going to get us too far. I mean, to be honest with you, this community is really quite has been really quite good. I mean, when you go out and are observant in other communities, it's really rather amazing. And we've done that the way we do law enforcement generally. And if we haven't done it with a hammer, we've done it with a communicative effort. It's just that without a person dedicated to that task, it's difficult to execute on it. So that will change, hopefully in the near term, certainly without too much time going by. So there's that. When you think about Ann's comments, in particular into what my observation has been is that the recent period of enforcement in response to public health complaints or to public health issues has been in the realm of restaurants and bars and taverns type of a situation. And you can kind of see why that is, because once those establishments are open, there's a relaxation. I mean, you go in and you're feeling good, and you're feeling like it's almost like it was before the COVID hit. And you're letting your hair down and it's like relaxing for a change. And so it kind of builds on itself, and the restaurant and bar relaxation and public health orders is kind of the final step. I mean, when you think about it, what public health issue doesn't have some interaction with a bar? So the problem that Ann is trying to address is, I don't feel personally, is something that is best addressed by clubbing somebody over the head. And as an example, it's not particularly favored in a judicial setting anyway. You want to try to have your enforcement fair. You want to have your enforcement equitable. So, I mean, for example, in the bar restaurant scenario, my observation has been that it's difficult, even for us to deal with this. Are you a restaurant that's serving booze? Are you a bar that's serving, wings and snacks or something? What makes one establishment one thing and makes another establishment another thing? To be honest with you, in dealing with that situation, we have been prepared in one instance to go to court and are planning to do so if something doesn't, change the equation, and do that, do that beginning of business tomorrow. But that doesn't necessarily solve the problem that exists within those businesses in their attempts to comply with the health order, and in our attempts to reduce transmission as much as possible while still letting businesses open. The board might consider approaching the issue a little bit differently. For example, just hours of operation. If you're open for business and you have an establishment that has a liquor license and can serve, liquor retail, individually to customers, then and it's midnight, you're running a bar. So our health orders right now prohibit bars from being open today. Our health order right now allows restaurants to be open with certain compliance issues. So, just changing the hours of operation might go a long way to not only particular recalcitrant or observed recalcitrant individual establishments, but to set up a framework more broadly across the board. So that type of an approach is something to also consider.
Ann?
Yeah, thanks, John. I don't think any of us are out there advocating clobbering people over the head. But I do hear from restaurants who are trying very, very hard to comply, and they see other restaurants and bars that are out of compliance, and they just, with no consequences. So I think if we do, it makes a lot of sense to have one person that is one or two people in charge of monitoring, so there can be some consistency. And I'd like to know what plans are for that. The other, I was going to bring that up later. I agree with you completely about the hours of operation. I think there's a lot more social interaction after 10 o'clock, even if they're serving some bar food. So maybe something we should think about is closing down the restaurants and bars at 10 or 11. Thanks.
And Nan, I'm happy to move, Marky, I'm happy to move into the exciting phase of the consumer protection program, but I want to honor all these good questions around enforcement.
I think there's you know, and I had hoped we would never, ever have to see an
Could I
ongoing.
comment, please?
Yeah, just a second, Tom. I had hoped that we would never have to see and experience having to move through a progressive disciplinary action, which it appears is exactly what we're doing. And we'll get into a little bit more discussion here relative to what Ann's comment is and the whole progressive discipline process. And Jeanette, I've got another question, so I'm going to call on Tom.
Yes, can you hear me? Yeah. We appear to be dancing around the issue of enforcement, and I suggest that we authorize the police officers to issue a simple $100 fine for people, those in violation. And the word would get out through the media and other sources after about 6 have been issued, and I think the compliance would be much better. Can we discuss that?
Well, I'm going to turn that one to John.
Well, a summons and complaint type of a response by law enforcement is available to law enforcement officers now. It's still a matter. It's not a decision made in the field, so to speak. It will involve a court appearance and a hearing or trial, depending on how depending on the context. And it would involve a judicial determination of what level of fine is appropriate, or if a fine is appropriate, based upon a fee schedule set by the public health agency. So that you can go that way, but it's not necessarily an immediate response.
I'm not talking about food establishments. I'm talking about the public that's in violation of these wearing masks, et cetera, in public, as we all have noticed and commented on. If a member of the public is in violation, why can't a peace officer issue a fine in the scene?
Well, they can. And if you look at the flow chart that Jeanette and Giordano worked on, you tree that off as to individual and business type offenses. An individual offense being something that is a person-to-person type of event. You know, you're too close, you're engaging in something that is threatening and or potentially dangerous through the transmission of disease. You're not wearing a face mask. You're walking up to somebody and putting your hands on them. You get any number of different things, but a law enforcement officer responding to that type of a scenario is free to disengage and to try to the people involved and to try to address it as appropriately they see fit in the field, like they would in any other law enforcement situation, which includes writing a summons and complaint into court, for which they would be liable to a fine, potentially $5,000, and that can be argued for or against in the amount that is ultimately imposed. It can involve detention of the offending individual and actual confinement, which means, you know, talking about arrest. So all that is available now and is basically within the protocol, because that is something that law enforcement is certainly used to dealing with, trying to establish peace and to quell a potential disturbance or potential dangerous situation, and then dealing with the offending party in an appropriate manner. Law enforcement officers in our community are trained to do that and to do it appropriately. And those types of actions are certainly available to them right now.
Mark?
Brent?
Yeah, I would just say I agree with Tom. You know, either this is important or it's not important. And I think we're all sitting around here saying how important it is. And this kind of a thing, if we could limit it to a $100 fine, would be very annoying. And even if the cop on the beat decides he's not going to ticket the guy, he's going to momentarily embarrass the guy or the person, the woman, and the word will get out that we're tightening down on enforcement. You could be subject to a $100 fine. And hopefully we do find a few people. And I think that's all we're trying to do, is get some sort of awareness, get people thinking, you know what, this could cost me some money, and it could even be a little embarrassing. So I'm going to wear my mask. So I'm afraid, I agree with Tom's idea.
Thank you.
You're welcome.
Any other comments?
Yeah, can I just say something, Marky?
Yeah.
In speaking with the local Aspen Police Department, I think they need to be brought into this discussion. They are in some ways uncomfortable with enforcement of some of the public health mandates, I think pretty much related to the relationship they have with the community and what's going on a national level with police enforcement. So I think we need to be very careful. Not that I disagree with, we need to let people know we're serious about our public health mandate, but we also need to have law enforcement on our side in this and how we're going to move forward into the community. And I just think that has to be a conversation we have with both the sheriff and with the chief of police.
Yeah, Patty, I really appreciate that comment. I think this whole discussion about the enforcement relative to masks needs to be a top on the list with our policing community. Tori, I see your hand up.
Thank you. I have one question.
I've got mine up too, Marky.
I have one question and then a couple of statements for the conversation that's going on right there. The question that I have is, I believe Jeanette might have referenced the COVID hotline. And I was just wondering, was she referring to that as is that a compliance hotline now? In the chart that was just up as well, item number 1 is something about the non-emergency number. So if there are compliance questions or issues, are we using that hotline now? Should we be directing people to utilize that for any compliance questions?
Marky, would you like me to answer that?
Yeah, please.
Okay, thank you. So Tori, in this next slide, when I have a chance, I can explain the whole future consumer protection program. In the first phase is moving from the non-emergency dispatch number to a COVID information line. That hopefully will be established early next week, but until we will do outreach on that, but it's not right. It's not ready there just quite yet. We need some back of the house work to be done on that, but that is the intention is, and I'll talk more about that in this next slide when after your other questions, but we will be moving away from the non-emergency dispatch line for public health COVID complaints and requests for assistance.
Okay, I know Greg had his hand up.
If I could finish.
Tori, go ahead and finish.
Oh, yeah, Tori had more, I think.
Yeah, just real quickly, I just wanted to say it was interesting to see the currently increasing cases and the hotspot chart that Dr. Levin put up a little bit ago. You know, a lot of our visitors that are coming here are coming from those places and locations. And we're seeing a lot of non-compliance by those visitors. To the points that were being made by Brent and Tom and others, you know, the city of Aspen and the APD has actually written some tickets for non-face mask wearing, over a half dozen or more. We may be up to a dozen now. And we've just allocated some resources to putting a street team out in order to do that outreach that can actually supply those masks. I as well, I agree. When we set up,
good idea.
When we set up the mask mandate, we were also, we did put a fine schedule in there. So it is a warning first. I believe it's a $50 fine currently. And so we're working on those avenues. We're deploying that street team. It's a lot to ask our APD to both carry masks in order to hand those out to the non-compliant people that they run into, and then ticket as well continually when you see how many people are not complying. But we are moving towards those efforts, and I agree with both of you that we need to be firm in that and send that message that we are requiring it. John Ely was referring to visiting a couple communities recently. I've had the same opportunity, and I'll tell you, actually, my experience has been really surprising to see how much compliance has been done in other places, and how Aspen and mostly I'd say some of our visitors have such a lackadaisical view on this. So we really need to work on that supply, getting masks to those that are not in compliance, letting them know that we do reinforce by enforcement to get compliance. And I support the comments of those two gentlemen. So thank you, guys.
Greg?
Yeah, hi. Just briefly, I'm hoping that if John could elaborate a little bit more on the role of the Board of Health and the Public Health Director. I know if Karen has to get into the difficult situation of having to lay down the law in some way or issue an unpopular order, I want to know how the Board of Health can support that, because we're in this too, and we have some statutory authority. I think it's been gone over at times in the past, but maybe John could just enlighten our Board of Health members about what we can do to support when we see times when Karen is going to be making difficult calls.
John?
Okay, sure, Marky. Well, we talked about this, I think it was the last meeting, might have been 2 meetings ago, about the statutory authority and duties and obligations of the Board of Health, the Public Health Director. And as those two entities and individuals comprise what is the Public Health Agency in Pitkin County, the Board of Health and the Public Health Director have consistent and similar capacities to issue public health orders and to require compliance of those orders. The situation I think that we talked about is that the statutory scheme envisions a communication between the director and the board, a concurrence in a particular plan of action, and a recognition that the board itself is more adept at discussing and establishing a long-range policy approach to public health problems and issues, whereas the director is much more nimble, being a singular individual, to respond to immediate threats to public health. So certainly the law contemplates, and I think everyone would anticipate and hope for, complete agreement between the director and the board, and support by one for the other on a continuing basis. And you're right, Karen could be in the situation where she's confronted with having to deal with a new twist or a new fact situation or a new problem that wasn't anticipated that might occur in between meetings of the Board of Health, and she would have to respond to that. And so the Board of Health, should support Karen, and because any situation like that, I'm sure Karen would bring back to the board at the next available time to explain and to debrief. I'm not sure what else to say on that particular topic, but we have a chance now so that Karen, as the health director, and the Board of Health can interact with each other to talk about, say the situation that Ann brought up, where you have difficulty in having complete compliance with the health order by establishments, particularly restaurants and bars. And although one particular one might stand out in our collective consciousness, I have to say there have been several complaints, and they range widely over the community. So it's a situation that perhaps deserves a second look.
Thank you, John.
Thanks, John.
Jeanette?
Hey, well, I went in to honor the Board of Health's time, I'm just gonna move into and do freeform with this new flow chart, because I love my flow charts. And I'm really excited to present to the Board of Health and to the community that we are, as the city of Aspen, as well as Pitkin County, we have job descriptions out, and we look forward to interviewing and hiring consumer health protection specialists to to be a support for these businesses. As I started this presentation, our foundation is to support the businesses reopening to stay open, to support the 5 commitments, to support the reduction and of spread of COVID in our community, and to enjoy our beautiful community. And so with the consumer health protection specialist hopefully coming online in July, we've developed a program with all the jurisdictions to be able to respond to complaints, but more importantly, to do education, outreach, and be in the community and be interacting with these businesses to provide them support. And so you can see here that we have Snowmass Village, we have unincorporated Pickens County, we have Aspen, and we have Basalt. And we have been working with them on developing this program and how we can all work together and collaborate to move the needle forward, to gain more voluntary compliance, to have less need for the next level of enforcement. And it really comes down to being in the community and working with the businesses. So each of these jurisdictions will have community health protection specialists visiting the businesses, checking in with them, seeing what's working, what's not working, what are their needs, to help them to speak to that employee or that customer that doesn't have a mask, and to what tools do you need to help you feel comfortable being a partner in protection of this community, as well as moving into finding out other things that we can do to improve our sector guidance, as well as informing future public health orders. So we see the county consumer health protection specialists moving into and working with the local law enforcement agencies of Snowmass Village and Basalt, and letting them know we're coming in, talking to the sectors, the business sectors, and they're informing us if there's any areas that need extra attention. We would be working with them as far as any complaints, if that's and having a conversation. Is it a complaint that you want to take on local law enforcement, or do you want the community health, consumer health protection specialists responding to, or together? And so it's really a collaborative process. I'm excited to be leading the charge for City of Aspen's consumer protection program. Our goal is to work with the businesses the departments that are already doing that work in the meantime until we get our consumer health protection specialists. But these people that we're hiring, they're going to be customer service, they're going to know the community, they're going to be living in the community and wanting to help our businesses. So with that, if you have specific questions about education, outreach, tracking, enforcement, or collaboration, I'm happy to touch on any of those with questions. But just to circle back to what Tori said, the information, the COVID hotline that we have is going to be turned into an information hotline, and we're going to have a Google form to register those complaints. It'll go into a spreadsheet that all partnering agencies will be able to use to track and monitor the complaints that are happening and respond accordingly. It is important to know that we want the non-emergency dispatch line to be used if there's an individual issue, such as some of the examples that John has given. So that would be and we will have that communication on the county website, and dispatch will be a partner on that. With that, I could keep talking, but I'm going to leave it at that and see if anyone has questions about the program.
Is that hotline available 24/7?
The hotline will be, you will leave a message, because the expectation is not that it's a dispatch. These, public health crisis is important, and it is a risk for community health, but this is different than life and safety. And so we want to we want the community to be helping us monitor, and we want to know about these matters, but the response time is not going to be as immediate as someone's concerned about their life and safety. And that'll be communicated in the message. So we're working on managing expectations and providing different options for the type of information they need or the complaint they want to register. The next phase would be the consumer health protection specialist would call them back and get more information and then respond.
So Let me finish my question, then I know, Tom, you had something to say. So in an instance, it's a Saturday afternoon and I'm going to work, I work at a restaurant. This is an example. I don't work at a restaurant. And I'm not feeling super well. I go into work and my boss says I need to go get a test. And obviously it's a Saturday. Physicians generally don't work. They generally have someone on call. So how would we be able to get information to that person? Because I would probably call the hotline and ask that question. Obviously I used the hotline the wrong way.
Well, the information, it'll be an information line and there'll be a button for testing. They'll have information about testing. So this isn't just for, this is not a complaint line. This is an information line. And one of the options, it'll be in English and Spanish. And one of the options will be, do you have a complaint? There will be also, do you need assistance? You have a question about testing. Are you interested in the services that the Health and Human Services Division can provide? So it's going to be all-encompassing.
Thank you very much, Jeanette. Boy, takes a lot of time to build out that entire system. So God bless you. Okay, who else had a question? Tom, did you?
Yes. What if that person, I agree with you, Marky, what if that person on Saturday afternoon has a fever and a cough and the restaurant owner does not necessarily know what to do? That person doesn't have a personal physician because he just moved to Aspen a month or so ago. How is he going to get tested?
So first of all,
Should he work on Sunday? What's going to happen till Monday?
Okay, may I answer, Marky? Okay, so I want to first recognize that every business open has to do a business safety plan. And in that business safety plan, they are educated and agree to do symptom checking and to, if they have an employee that comes with a fever and symptoms, that they direct them to testing. And there's steps on information for them in that are links, and there's additional information that would be on the hotline. As far as getting immediate testing, that's something that we don't have the capability to if that's what you're implying, Tom, as far as immediate testing. There is a time and there is a process, and this person is sick, and so they should go home and call their doctor and take care of themselves. If they have a fever, they shouldn't be working for several days if they're sick with the flu or with COVID.
What if this person is a tourist?
I'm not sure what you're asking.
Can I just try to answer this question?
Thank you, Kim. I couldn't see you.
Oh gosh, of course. I think the conversation has shifted from what Jeanette is presenting to a testing question, and which is outside of what you're presenting here. So in terms of testing, yes, we want everyone to get tested as soon as possible. If you're here and you don't have a doctor, I had just showed the slide. That's the Aspen Valley Primary Care. You call their number, you can get tested through them. And if you don't hear back right away or whatever it is, you go home and you isolate. But testing is available here. It's available for every symptomatic person. If you're local, if you're a visitor, if you have a doctor, if you don't have a doctor. And that is the whole key to the public health process and boxing it in. And so it is every individual's responsibility and an employer's responsibility to instruct that individual to get tested if they work for them, but also the individual's responsibility to reach out to Aspen Valley Primary Care if you do not have a doctor, and you will get a test. I hope that helps.
Yeah, thank you. Jeanette, did you want to continue with your presentation?
I guess I just want to end with the collaboration piece. The education is going to continue with the business liaison. We're going to have more education with our consumer health protection specialists in the field, working with the businesses. In City of Aspen, we're going to have the ambassadors out educating the visiting community, providing tools that we can coordinate and help the restaurants connect a person to get a mask so they can be served at the restaurant. We will continue to collaborate and coordinate with other departments that are doing outreach. So it won't just be these people, the consumer health protection specialists. We will be still coordinating in how to continue to have that span of reach out into the community, such as with the park, city and county rangers. And compliance, I mean, our compliance, just what John Ely said, these people will be trained in the way of the law enforcement. And it is the bent knee approach, it is listening, it is communicating, it's and building understanding. And that's successful. And I just want to assure the city and Snowmass Village and Basalt and the county that this is a collaborative effort, and we will build this system so that the community, I mean, the consumer health protection specialists, both in the city and the county, will have a means to communicate and connect with the business liaison team and continue to build the system in a collaborative and uniform way. And that's my presentation.
Thank you so very much, Jeanette. I wish that we were all in the same room because we could give Jeanette a great big roaring set of applause. A lot of great work, just impressive how far we have come over the last few months. So to everyone, hats off and job well done. Now we're going to be moving into the next part of our agenda. And we've had this on the agenda for a period of time, and we really haven't had time to talk about what board members are hearing from the community and from various businesses. So with that, Patty?
Unless the agenda changed, are we not doing the roadmap for reopening that Kara was going to provide?
Yeah, Patty, we thought we would end up having more time to do the presentation.
Okay,
so
that's fine. Just want to make sure. And the only comments I'd like to make about the round robin part is that apparently my earlier comments about communication may have been misinterpreted. I'm just saying that if we want to utilize the press as a media for us to get the word out, which I think we should be doing, we need to find a better way to do that. And I think it was Greg who mentioned the use of Tracy, who she does an amazing job, has a good relationship with the local media. I think that might be a good avenue for us to look at to not to really point the finger at anybody on our public health staff, but to say we have an avenue now with Tracy, and I think we need to find a way to better utilize that to take advantage of the media getting the word out to the public.
Yeah, and I just wanted to add to that, Patty. So we have a media call scheduled actually right after the Board of Health meeting so that we can connect with the media. We're trying to get one more set up, I think, each week so that we can have more of this concentrated communication with them.
Great. And I think the use of Tracy is a good idea because, again, she does an amazing job for us. So thank you.
What are you hearing out there, guys?
Tori, are you still on? Do you want to go through your email or do you want me to cover that?
Yeah, why don't you?
I appreciate that. And I would love to have you go through some of those items. Thank you.
All right, I just pulled it up, so go ahead, Ann.
Okay, great. And again, thank you very much, Tori, for joining us. So there's 4 items on here. One was a discussion about a call number and email for compliance issues, but Jeanette answered that. Thank you very much, Jeanette. Adding a case number countdown based on the 17 cases in a week threshold. This information could be helpful for people understanding and perhaps heeding the health orders. So again, maybe a different way of tracking what's going on and, you know, if we're improving or not improving. Information on compliance and enforcement programs. And I think, Tori, you might add, if there's not enough on the website, there's quite a bit lately on the website, but if there are other ways to communicate it through newspaper ads or the city website, whatever, people are still apparently confused on the compliance and the distancing. 4, are we ready for increased lodging capacity? And how are we going to determine that? And then I had a couple other things to add. Do you want me to just add mine too? So questions about tracking and monitoring passengers at the airport. This continually comes up. How are we protecting ourselves from people coming in through the airport? Continued non-compliance on trails in parks and restaurants. Continue to hear that. And then the communication to visitors. I don't know whether people think that this is a great safe place that's never heard of COVID, but it is really apparent that people come to town that just kind of let it all down and relax and not worry about what they've been doing in their home states. So that's a few things that I've heard. Oh, the last was support of closing restaurants and bars at either 10 or 11. Just considering, as I said, there's much more social interaction after 10 than there is previous to that. That might help. So those are my questions, my comments.
Could we have an update on the airport? What's going on at the airport? And I have no idea. I'm not flying. I know we've talked about it. Karen?
Yeah, and I think John Peacock is on. He may have popped back on. John, are you here to give the latest update? Or Kurt probably has the most up-to-date information on what's happening at the airport.
Oh, there's Peacock.
Oh, there's John. Okay.
All right. Sorry. Yeah, as you caught me multitasking. Marky, we've been working on a symptom screening process. The airport has ordered thermometers, but I think as our public health staff will tell you that temperature checks in and of themselves are not necessarily effective. Karen, I think it's roughly 30% of positive cases are carrying a temperature. So do I have that right? Okay.
Yeah, and I think just to reiterate, John, like it's the full symptom screening that's most effective, not just one of the.
Yeah, and so that's where I was going to go, is that's too big of a hole in the net. And so we are still working on a process for full symptom screening that can accommodate the volumes that we may see as more people travel by airplane. And that is a challenge given our facility and such. So we're not there yet, but we are working on that up to including looking at if there are electronic options or more options for working with the airlines to try and get information early. So in the meantime, Marky, I don't know if anyone's had a chance to be out at the airport, but there is a lot of information. Every passenger is getting information about the public health orders, the 5 commitments to containment. The airport itself has had a lot of both facility improvements as well as informational improvements around COVID. And most recently, the board also appropriated funds for regular, not only more regular cleanings, but decontamination of the facility given its high use. That's about all I've got. Sorry, I'm looking in the wrong camera. I've got 2 screens going. I can't see which camera I'm supposed to be looking at here. That's better.
And Marky, Tracy Truelove, our PIO, is in text contact with me, and she just wanted to let everyone know that ACRA and ACRA, Ghost, Snowmass, and Basalt Chamber are all pushing out visitor information, and I'm tying that back to the website, and there's a really good communication stream between those groups and the PIO.
I thought you'd all appreciate this new Zoom background for COVID.
That's a good one, John.
You need to get a day job.
Yeah.
And John, I asked that a question. I realized I haven't been to the airport since mid-December. So maybe I need to go out there and see what's going on.
Yeah, and there is the video also that walks through a lot of the facility improvements. I believe that's still available on our website. I think the Aspen Daily News has it on their site also. And that has been the trend. And a lot of people haven't been at the airport. Our numbers are still way down in terms of travelers.
Okay. Other comments that you're hearing from the community? And we didn't answer everything that you were talking about. You said one was lodging.
Lodging. I think everything else Jeanette pretty much answered, but the other specific was the lodging.
And Karen, can you talk about where we are with lodging, or is Kara's on the line or on the call? Could she talk?
She's not on the call.
Okay.
So we are bringing on Monday, June 22nd, we're going to bring back the conversation around lodging. Right now, as you're all aware, we're still at 50%. Where I think the last county, maybe in Colorado, that still has some restrictions on lodging, and wanting to bring that back to the medical advisory team. And I know it's been brought to the agency administrators. So Clint and Sarah and John and Ryan have all discussed it, and their recommendation is to go ahead and open to 100% by the 26th, June 26th. And so that further conversation will happen on the 22nd. And we'll be bringing back there are a number of different things in the amendment of the current public health order, as the state, as you might aware, changed their order as of today. We knew that 2 days ago, what they were going to be changing. So we're always in this reactive mode. And it does give us a little time though to make our own decisions. So there are a number of different things that the state just opened up today that, you know, some of them I think are low hanging fruit, low risk scenarios like opening up museums. And we had already been working on a variance to propose around opening museums because it's certainly a low risk activity as compared to some other things. But you might be aware that the state just opened up bars to 25% today, which is a little bit more risky than opening up a museum. So that's part of the intention, is to review the things that happened today, next week with the medical advisory team as well as the public health team, and then make recommendations on the 25th for changes for the 26th. And then the other piece, so that's amendment to our current public health order. And then the other piece we wanted to bring back to the Board of Health next week is this whole idea of the protect your neighbor. And that, again, we are, it is really, there's not much restriction. It's really 500 people is the group size, and 50% capacity. That's the restriction. That will be the restriction across the state. And so that's a really different model than what we've kind of been working through. And that's a big change. So I think if we make these changes to our public health order next week, they'll be in effect for maybe a few weeks. And then we have to decide kind of what we want to do from that movement forward.
Yeah, I'm getting a little nervous with that. And I read through it, Karen, the state, what we're up to. I can't imagine an event at 500. But I want to ask you one question, Karen or Kim, and then I see hands going up. Relative to, we're at 17 new cases, if I'm correct, in the last 2 weeks?
Charlie, do you want to jump in? I think it's not 17.
15.
15 in 2 weeks.
Okay, so then the question, just to remind all of us, what is that threshold when the state would require us to go backwards? Was it 18?
18 in 1 week.
In 1 week, okay. Thank you for that clarification. With that, I'll see if there's other questions. Patty?
Of the mass size of 500, which is a big jump from 50 to 500. Have we had any discussion, and maybe I missed it, about the demonstrations? We know that they're occurring. We know that there's social distancing is in question. We know that the mask wearing of facial coverings is in question. We know there's the constitutional right of freedom of speech. But it also, to me, is such a risk factor. The diverse demographics at these demonstrations, the proximity of people. I don't know what we can do or if there's anything we can do to address that, but to me, that's a huge risk factor for us out there, because we really right now have no control over it. Any thoughts?
We were sorry, recommending, but we haven't been able to have the staffing to pull this off. Putting together safety kits for folks just to, again, kind of protect their health and to remind them of the social distancing, mask wearing, ability to get testing at ABH if they were symptomatic, and kind of putting together these kits that would have a mask and hygiene items, testing information, what you can do to protect yourself when you are in an event around protection around COVID in particular. And so just having this ability to say, this is still really, really important that you maintain your social distance and that you wear your mask and do these things that we know are going to help you and your health long-term.
And I think that's a great idea, and I really support that. The problem is sarcastically, I've heard from restaurants, wonder if I want to host a demonstration for these causes in my restaurant and have 200 people, and it's their freedom of speech. I mean, so there's a lot of feeling of, if they can do X, why can't I do X? And I know it's very different, but at the same time, they're seeing the similarities of, I'm being restricted, but this entity is not. So that's a tough one, and I know we can only do the best that we can possibly do. And I think the one thing that we do well is to educate and continue to educate the community on the do's and the don'ts and the whys and the why nots. So whatever we might be able to do to help in that as a board, as county commissioners, please let us know.
I have a comment for you, Patty, just a question. In terms of the local demonstrations that are going on, have we engaged the leaders, the two leaders, one from Glenwood and one from here in Aspen, as to them when they get on that loudspeaker, is to remind people to wear their mask and all that good stuff?
It's a good question. I don't know, because they're hosted within the city limits. And I don't know if the city has reached out to do that, but that's a good place to start.
The answer is yes. Yes, we have. We've been in touch with them, and we've been forwarding mask wearing. We've been forwarding the message of social distancing. We've seen some gains and some great improvements from them. They are definitely cooperative. It is not their intention at all to put the public health in danger here at all. We have been in touch, and we will continue to be.
Thank you, Tori.
Hey, Brent?
Well, Tori said a little bit of it, and Patty and Karen. To me, it comes down to, right, if we had 100% mask wearing compliance and people really trying to keep 6 feet apart, 500 people together wouldn't be quite so bothersome. But on the other hand, if it breaks down, then we see these petri dishes that we've seen in Florida. And I don't know what we can do, except to Tori's point, make everybody as aware as we possibly can. It's kind of a litany that we have to keep telling people. Make masks readily available. If you had 500 people out in a yard somewhere, there's masks available as they come through the door and into the area, and with disinfecting solutions and things. I mean, it's about all we can do. But I think it gets scary as we expand, because we don't know what level of compliance we're going to see until it's too late.
Thank you very much. Yeah. Now I'm going to move on. In the interest of time, we have 7 minutes left. Karen, you want to talk about the agenda for next time, kind of what you see in terms of stuff you'll be sending out and what we've talked about so far in terms of the agenda and prepping all the board?
Yeah, so I guess I'll send you the information from the state, the two presentations and the framework for your review for next week. Also a couple of different amendments that we could make this next week around the public health, our current public health order. And then looking at, those are the two really big things that I have on my agenda. We've got, I took the notes from Anne as far as the topics of discussion, and from Tori. If there are others, we did send out that Google form to you all to put these kinds of rolling things in what you're hearing from the community. So you can just keep plugging. I don't know if we've gotten any responses on that form yet, but go ahead and put your information in there if you didn't get to speak today, so that we can collect those and just keep that ongoing and rolling.
I think it'd be wonderful to get an update next week as well with our consumer protection program and where we are. John perhaps could give an update on from the legal side of where we are with compliance. So what other agenda items might any of you want to hear? Cam, you'll be on the agenda. Charlie, you'll be on the agenda. It's all this data. And let's hope that we go the other way and not have more cases. Okay.
Well, Marky, I was just going to say we could update you on our street team on how that's going, because I think that'll be very effective in education.
I think that'd be wonderful. We haven't had to do any of that type of work here in Snowmass Village because there's no one here. Not yet, but we may have to.
We'll send everybody over.
What's interesting, our council is very, very active, as long as their health will allow, going out and really talking to restaurants and seeing how they're doing and kind of doing some monitoring ourselves. So that's kind of our street team right now. So, yeah, Kim?
I just wanted to make one last comment. I've just been thinking as this goes through, and I'm just so impressed with how more functioning this group is and how we're all communicating and working so well together. But just from a physician point of view, I just didn't get to give my 2 cents, and this is from what Brent said a little bit about the reality of this disease. I've just been thinking a lot of the data is around death and around older population, and that's a really easy data point to look at. How many deaths and who's dying, and let's protect that community. But from a physician's point of view, and what I've seen in the ER, I worked at Valley View ER yesterday, admitted a patient with COVID. The reality of this crazy virus is that the morbidity, and it's a very difficult variable to collect and to quantify and result in all ages, is that it's very high. And what I mean by that is it affects people in negative ways for months. I have seen young people for months who have had continued shortness of breath, who have been on oxygen for a long time. And I think there's a huge amount of data that we're missing here that we're not collecting on kind of the negative, huge effects of this virus. And so the focus on the older population and having to social distance at 65%, and that is correct in some ways, but it's not the whole picture. And I really want to give that picture to the board and to the community that this is affecting younger people. We intubated a woman 40 something years old with diabetes, flown to Denver the other day with COVID. The seriousness of this and the effect that it has on healthy young people, although they're not going to die, and we don't get that data point, we need to quantify this somehow to make this a reality to people. And the seriousness of everything we've talked about today, supporting that and supporting all of these measures and the 5 commitments, and the seriousness of this, which I applaud the board for taking it in that direction.
You know, Kim, just before we adjourn, I think it would be helpful next week, if the agenda will allow it, is the vignette from a physician's point of view, the progression of the illness over a period of time. Because again, it gets back to communication, and what we can get into the press is how hard this disease is to fight. I have a dear friend that had it way back in early March, and she's still on oxygen. A lot of respiratory problems.
Different from the flu. And I also like the idea of a countdown on the dashboard of the number per week. I can't remember who recommended that. Maybe it was Ann, but I like that idea. And that'll give the community an idea.
Yeah. From Tori through me.
Okay, I know you have a press
Good
conference.
idea, Tori.
Greg, you ready to adjourn, or you have another point?
Thank you. I had one quick point, only that I think that it's the point I was trying to get to earlier is that I think the Board of Health could play a larger role only in assuring the public that the decisions that are going to be made, the tough decisions that are going to be made by this body and by Karen, really are backed up by citizens from our community who comprise the Board of Health. And I think that it's possible that it's time for the Board of Health to take a higher profile and maybe do some op-eds or to let the public know that these decisions are being taken very seriously and that it's a group of citizens who are backing them up. And I kind of think that that might help, one, give Karen some cover and ability to make the hard decisions she's making, and it will also give the community a sense of confidence that it's citizens, the community are actually making these calls. And I just think that it might be time for that.
I'm looking at the time tick. Tori, you
As
had
we're
your.
looking at more serious, if you need a motion to adjourn, then I'll make the motion and then we can discuss
Yeah, we need a motion to adjourn.
it.
Thank you. Do I have a second?
I'll second.
Thank you.
Oh, no, Tori's here. Sorry, I can't second it.
Well, he raised his hand for you.
Oh, okay.
Everybody, any further discussion? If not, all in support of adjourning the meeting. Okay, thank you all. Great meeting.
Thank you, Marky.
Thank you. Thank you, Marky.